You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, he says nobody should be wearing a loose fitting denture. With us, we have one of Tennessee's go-to implant dentists, Dr. Dushyant Patel. Dr. Patel, welcome to the program.
Thank you so much. Long-time listener. Happy to finally be on the program.
Now, for people that don't know your implant center, like who's the typical dental implant patient?
So Randy, I would say the typical patients are in two categories.
Okay.
One category, they're the patients that typically they don't have the best teeth currently. They have bleeding gums, they have bad breath, they have cavities, they've been told they need a lot of work done. Maybe they've even been told they need a denture. Typically, they only come in when something's hurting.
Okay.
And for those people, if we can't save their teeth, we'll go ahead and remove their teeth, give them 4 implants and a whole new set of teeth, and give them their confidence back.
Okay.
And then the other category of patients typically are the ones that we see few and far between, unfortunately. And that's because they're already missing their teeth. They're already wearing a denture, or maybe they're not wearing anything at all.
Okay.
And they haven't been to a dentist in 5, 10, 15, maybe more years because they don't have any teeth. Nothing hurts anymore, therefore they don't need to come see me anymore.
Okay.
Every once in a while they might come in to get a new liner in their denture, and they don't really know the options that are available to them at the moment. They've been out of the system. They don't really know what dental implants are or how they work or if they're even a candidate.
Okay.
And those are the patients that we oftentimes can just get them in one visit, and the next visit they could be leaving with a whole new set of teeth permanently fixed in their mouth.
Okay.
Yeah.
Is that now, when we said at the top of the show, no more dentures, no more traditional dentures, do you think that's a future of dentistry? That 20 years, 50 years, where dentures as we know them won't exist, they'll all be attached to something like implants?
Oh, absolutely, Randy. I mean, right now, the improvements in the quality of life that even as little as 2 implants can make for someone is just so drastic. I mean, we can get someone that will actually give them teeth that aren't going to fall out when they're laughing.
So like 2 implants, what? And that makes a snap in, snap out?
Snap in and snap out, exactly.
Okay.
And, you know, some of the most embarrassing things that people have to deal with when they're wearing dentures is when they're laughing, their denture might fall out. When they're at a party and